Well, Dr. Hal, it's great having you with us, but why do you think heart disease is increasing?
Well, heart disease in general is one of the leading causes of death for the simple reason that we're getting better at treating people and extending their life. Things that used to cause people to die, cancers or heart attacks, we're starting to treat them better, so patients are actually living longer. Over 5 million people, though, in the United States suffer from heart failure. And heart failure is nothing more than the inability of the heart muscle to push blood out in the forward direction to provide for the needs of the body. When blood's not coming out in adequate amounts to the muscles, people start to feel fatigued and tired. And when that blood's not being pushed out, the blood backs up into the lungs, causes them to feel like they're short of breath. Then backs up into the system, into the belly and the legs, and they start to notice swelling. So heart failure in and of itself becomes this common final pathway of people who have had heart attacks or people who've had valves breaking down or infections, and that's why we're noticing it in greater instances.
Doctor, so glad we're connecting with you. Great information, but what is acute heart failure?
Yeah, so when we're talking about acute heart failure, remember that the symptoms that I just described for heart failure, that shortness of breath and that fatigue and that swelling, when those things either start to accelerate really in a very short period of time, or the swelling starts to increase rather dramatically, that's what we call acute heart failure. And over 1 million people are hospitalized each year with those symptoms. Once they get into the hospital, sometimes it's life or death. We have to rapidly get in there, get the fluid off of their body, and then start to readjust their medications so that they're able to most efficiently push the blood out in that forward direction and not have it back up in the system.
Wow. What is the call to action, Dr. Hal?
There's no doubt that if you're starting to notice symptoms, you need to get in touch with your doctor. You need to have a conversation to be able to identify what the cause of those symptoms are. Having said that, once you are hospitalized with heart failure and you're discharged, that's not a moment to get complacent. 1 in 4 people who have been hospitalized for heart failure are going to have to be readmitted into the hospital within the next 30 days. 20% of all people who are discharged from the hospital with heart failure are going to die within the next year. So it is critical for you to get back in touch with your doctor upon discharge so that you can both optimize your medications, making sure you're on the right medications at the right dosages. Optimize your lifestyle. Your doctor should be able to give you a specific prescription for your exercise and for your dietary habits. And thirdly, to identify the triggers, the things that make your particular heart failure get worse, to identify them and to change the way that you do things to make sure that you are living this wonderful, long, and very, very symptom-free life.
Well, we certainly all wish for that kind of life you just described. Thank you so much for your passion of the heart and the information you shared with us today, Doctor.
Thank you very much, Con. It was a pleasure.